Welcome to your virtual pulmonary rehab course. My name is Shannon Maxim and I am a healthcare support worker for the West Hampshire Integrated Respiratory Service. Just before you start, I want to talk to you about some really important health and safety tips that are going to keep you safe over the next 12 weeks. You have had a pre-course assessment and have agreed to take part, which is fantastic. You are now ready to participate in one of our courses, and one of our staff members will go through all of the relevant information that you need during the course. The first thing to talk about is your room layout. So please use the layout discussed and agreed with the clinician at your pre-course assessment. You will need to keep the same room and use the same layout throughout all of your sessions. Please ensure that your camera is set up so the staff can see you at all times. You will need to clear any trip hazards out of the way before joining the call, such as any tables and chairs, etc. You will need plenty of space in your home environment to exercise. It is really important that you remember to keep all your inhalers and your GTN sprays close to you when you're exercising. Keep all your trip hazards out of the way, such as any pets, wires or objects. Please keep your drinks bottles at a safe distance to prevent any spillages, but close enough for you to reach. It's really important that you stay hydrated, and we will give you plenty of opportunity for this during the sessions. Also, please keep your family members, where possible, in the home. However, to maintain confidentiality and privacy of the other group members, please ensure they're not in the same room. Please read and follow the health and safety information in your pulmonary rehab leaflet. This was given to you at your pre-course assessment, but don't worry, we will remind you of this as you go through the sessions. Now we're going to talk about communicating on Zoom. You will enter the call automatically muted and will need to unmute yourself to talk. We will mute all patients when exercising, and this will prevent any background noise and also allow the instructor to be heard clearly. It is important that we're still able to communicate with you, so we will use some hand signals to do this. Don't worry, if we see that you need assistance, we will individually unmute you and talk to you. Thumbs up if you're okay, thumbs down if you're not okay, and if you're not feeling right, please sit down. If you need to speak to a staff member privately, please contact us before the virtual pulmonary rehab session. If it is during the session, please let us know and we'll be able to put you into a separate breakout room. We will talk you through this if it is needed. Also, during the call, if you need to go out of view, please let us know before leaving. If you're going to be late or you need to leave early, please just tell us. And if you leave the call and struggle to get back in due to internet issues, just please give us a ring. Before we start exercising, if you're feeling unwell or have any aches and pains, please make us aware before we start. Please let us know if you have had any medication changes or any other changes since your pre-course assessment. Please wear appropriate devices such as your hearing aids, oxygen and your glasses during the virtual class. If you have oxygen, please use this as you've been advised. And also, please ensure that you keep your equipment stored safely, and this will prevent any injuries during the exercises. If you need to speak to a member of the team regarding any concerns or queries, or if you can't attend a session, please get in contact with us. Email us on shft.respiratory-assessment@nhs.net. And last but not least, please remember, thumbs up if okay, thumbs down if you're not okay, and if you're not feeling right, please sit down. Thank you very much for listening, and I really hope you enjoy your course.